everyone, and welcome back to my YouTube channel. If you're here for the first time, hi, my name is Busari Malayo and I am a Nigerian registered nurse and midwife. I'm also a United Kingdom registered nurse. On this channel, I film content related to nursing and healthcare. And in today's video, I am going to be discussing the nursing care plan for burns. So stay tuned. Now let's have an overview of what burns are. Besides, we don't want to just jump into nursing care plan for burns without knowing what exactly burns are.
Burns are injuries to the skin and underlying tissues, and it can be caused by heat, either from the sun, hot substances, can be caused by chemicals such as acid, can be caused by electricity, radiation, or friction. Burns are generally classified by how deep and severe they affect the skin, and this will also determine how they are treated and cared for. Regarding the classification of burns, burns can be majorly classified into three types, which are first degree burns, which are also called superficial burns, and it affects only the outer layer of the skin, which is the epidermis. A very common example of that is sunburn. Then we have second degree burns, which is also known as partial thickness burns, which affects both the outer layer, the epidermis, and also the dermis, which is the second layer of the skin. Then we finally have third degree burns, which goes beyond the epidermis and the dermis and goes into the deeper tissues. This is also known as full thickness burns. While the degrees can help us know the depth, Wallis rule of nines can help us talk about the body surface area, or the area of the body that is affected by burns. And basically, the Wallis rule of nine is a quick and practical method to estimate the total body surface area affected by the burns. And this method basically divides the body into sections, and each of these sections is either approximately 9% or a multiple of 9. And they use it in an emergency situation where you want to quickly access the severity of the burn and also get a guide on how to treat that burn. Now, the Wallis rule of nine is different for neonates and adults, but for the purpose of this particular video, we'll talk about the Wallis rule of nine for adults. So according to the Wallis rule of nine, the head and neck is 9%, which is the front and back combined, which means if it's just the front, that will be 4.5%, and if it's just the other side, it will be 4.5, but both together is 9%. Each arm is 9% as well, which is 4.5% for the front and 4.5% for the back. Each leg is 18%, which is 9% for the front and 9% for the back. The anterior trunk is 18%, posterior trunk is 18%, and the genital area is the only part that is not a multiple of 9, which is just 1%. So depending on which part of the body the burns get to, the Wallis rule of 9 can be used to quickly estimate which percentage or what percentage of the body surface area is affected by a burns injury.
Now let's head over to the scenario we'll be working with today.
So for today's scenario, we're using the name Mrs. Kokumo. Please note that this name is not targeted to anybody. This is just a made-up scenario. So Mrs. Kokumo, a 35-year-old woman, was admitted to the emergency department after sustaining burns in a kitchen accident. She was preparing a dish when a pan of hot oil caught fire and spilled, causing burns to her face, neck, chest, and both arms. In the emergency department, the following observations were made. Her vital signs are as follows. Blood pressure is 140/90 millimeters of mercury. She has an heart rate of 110 beats per minute, respiratory rates of 24 breaths per minute, temperature of 37.5 degrees Celsius. Oxygen saturation level is 97% on room air. Then the burns assessment says that there's a partial thickness burn, second degree, on the face, the neck, and the chest, which is approximately 15% of the total body surface area. There's also full thickness burns, which is a third degree burn on both arms, which is approximately 10% of our total body surface area. Then there are also presence of blisters, erythema, and areas of touch screen around her body. And she also reports a severe pain of 8/10. 10. So obviously there is a lot of skin damage for Mrs. Kokumo and she is in severe pain.
Now that we understand the scenario, let's talk about the nursing diagnosis, the objectives, nursing intervention, scientific rationale, and evaluation of 3 nursing diagnoses for this particular scenario.
So here are 3 nursing diagnoses we can draw from the scenario. The first one is acute pain related to tissue injury and nerve damage, evidenced by verbalization of 8/10 pain scale. Another one is impaired skin integrity related to burn injury, evidenced by blisters, skin breaks, erythema, and charred skin. We also have a risk diagnosis of risks for imbalanced nutrition less than body requirements related to increased metabolic demands. So now let's pick each of these nursing diagnoses one after the other and draw a nursing care plan on each of them. So, starting with acute pain related to tissue injury and nerve damage, evidenced by verbalization of 8/10 pain scale, our objective is that the patient will express reduced pain and utilize coping mechanism effectively. Please note that for exam purposes, you should try to include a time frame to make your objective completely smart. I didn't do that in this particular video, but if you check my other nursing care plan videos, I did that. So the first intervention is to assess the pain levels using a standard scale. You can tell the patient to grade their pain on a scale of 1 to 10. And the reason is that when you consistently manage pain, or when you consistently assess pain, rather, it will help you to evaluate the effectiveness of your pain management skills or pain management strategies, and you'll be able to know where to adjust any of your interventions. Next thing is to apply non-pharmacological pain relief measures such as cold compress, that is if it is appropriate, and relaxation techniques. And this is because complementary pain relief measures can help to enhance the overall pain reduction strategy or pain reduction approach that you're trying to take. Next thing is to always position the patient comfortably and make sure you reposition the patient frequently to avoid pressure sores on the bond areas and increased comfort. Then the next thing is to administer prescribed pain medications, which could be either opioids or non-opioids as prescribed. I already have a video on the channel where I talked about analgesic. You can go around the channel to find that. Then, and this is because obviously pain medications will help to reduce pain, and it will reduce the comfort and promote healing and mobility of the patient. Finally, you have to educate the patient on the importance of pain management and encourage them to always communicate about their pain levels when it is low or when it is high. Things that they've noticed to always increase their pain, they should always communicate, because when the patient knows about these things, it is easier to manage with their own information, because pain is actually an individual thing. The patient knows when they are feeling pain. No matter how hard you try to assess, the pain is actually an individual thing. So basically, patient education promotes active participation in pain management and helps in early intervention. Now to the evaluation. Patient expressed reduced pain and utilized coping mechanisms effectively. Always ensure that your evaluation is in past tense and the time frame for the evaluation should be similar to what is in your objective for exam purposes to always get a pass mark. But ensure that your time frame is also realistic. It is not too short or too long.
Before we move on to the second and third nursing diagnosis, I need you to know that you can now access free audio lectures and free practice tests for your exams at nursing students on my website, www.nursingwithlight.com. You go over to the website and click on the desired tab depending on what you want to do that day. Click on the audio lectures and start listening to lectures or tutorials for free anytime, anywhere on our website. The practice tests are there to just prepare you towards your exams, and they are all free. You can also purchase ebooks that are targeted to help you pass your exams on the ebook tab of the website, and this YouTube channel is always there for more YouTube tutorials. Now let's go about to the next part of the video.
The next nursing diagnosis is impaired skin integrity related to burn injury, evidenced by blisters, skin breaks, erythema, and charred skin. And the objective is that patients will demonstrate improved skin integrity as evidenced by wound healing, without wound infection or infection of the skin before the patient gets discharged. This objective actually has like a long term plan, like the long term objective, because we are trying to make sure that the wound or the skin of the patient does not become infected before discharge, which means that the patient could have to be in the hospital for 1 to 3 weeks, depending on how much treatment that they need. So the first nursing intervention is to assess and document the extent and depth of burns upon admission, and do that regularly after, because accurately assessing the extent of the burns would help to plan appropriately, and you know the right treatment and the right frequency that you have to monitor the skin. Next, you have to perform wound care using sterile techniques to clean and dress the burn wound. And that's because if you maintain a sterile technique, there is a reduction in the risk of infection, and it will also promote a sterile environment for wound healing. Next thing is to apply the prescribed topical antimicrobial agents, either a silver dressing or Sofra 2. There are so many products that are applied on burns dressing, and this is because these agents prevent infection because they don't allow bacteria to grow on the wound surface. Next thing is to always monitor for signs of infection, such as increased redness on the skin, swelling, warmth, and purulent drainage, even things like increase in body temperature of the patient and pulse of the patient, because the earlier you detect the infection, the earlier you can actually take care of it and make sure that it doesn't go too far and cause a complication. Finally, you have to educate the patient and family on wound care techniques and signs of infection, especially if the patient has to go home or and they have to be caring for that wound at home. Because if you educate the patient and family, they would be more likely to adhere to the care plan, and they would also be able to identify any complication or any abnormality earlier and report to the hospital if they need to. So a simple evaluation is that the patient demonstrated improved skin integrity as evidenced by wound healing without infection before discharge. Now note that this evaluation is now in past tense, showing that we have achieved our earlier stated objective. Always take note of this in your examinations. The final diagnosis is risks for imbalanced nutrition less than body requirements related to increased metabolic demands. Now that the patient has a lot of burns on the body has a lot of metabolism to do or to actually act on to get the healing process going. So the objective is that the patient would demonstrate understanding of nutritional needs and consume adequate calories and protein to support wound healing within 1 week of nursing intervention. So we've given a time frame for this. So here are the nursing interventions. First, assess nutritional status, including weight, serum albumin, and pre-albumin levels, because when you have a baseline assessment or baseline data, you can easily identify when there are deficits in the patient's nutritional status. Next thing is to collaborate with a dietitian to develop a high calorie and high protein diet plan. Note that dietitians are specialists in this field, and it is nice to always collaborate with them for an evidence-based management approach for the patients. And this is because adequate nutrition supports tissue repair. You need the patient to be well nourished if you want wound healing to go on smoothly. So next is to monitor the daily calorie intake and provide nutritional supplements as needed. When you keep a record of what the patient is eating, how often they are eating, you will know if they are eating enough or they are not eating enough, and if they need nutritional supplements. You always make sure you take note of their weight as well, so that you know when they are losing weight too. Next thing is to encourage small and frequent meals and snacks to enhance nutritional intake. Now they may not want to eat large amounts of foods at once, so you can give them like small frequent meals so that you maintain their nutritional status. Next thing is to monitor and manage blood glucose levels, especially in patients that have pre-existing conditions like diabetes. We all know that a patient that has diabetes will have slow wound healing. So if your burns patient has a comorbidity like diabetes, you need to always monitor the blood sugar levels, and if they need to take diabetic medications, they should always do that when due. And here is the evaluation in past tense as usual. Patient demonstrated understanding of nutritional needs and consumed adequate calories and protein to support healing after 4 days of nursing. intervention. So by the fourth day, patient has started eating well and they understand why they need to eat well. That is basically what this evaluation is trying to state.
Alright, I hope now you understand how to solve nursing care plan for burns. If you want to see more of my videos on nursing care plan, click on this playlist here and I'll see you in the next one. Bye!